I'm Dr. Rogers at Stanford University, one of the electrophysiologists and a physician scientist. The figure that we presented in the first section of the article is really geared towards creating a kind of a straightforward workflow for people in the perioperative setting to have the information they need to take good care of the patient. It covers 99% of patients going through care. First of all, if the surgical site and the electrical return pad are below the lower half of the body, the chance of electromagnetic interference is actually quite low. And as long as the device is not in the abdomen, you can proceed with the surgical procedure without a high risk of interference. Next, we decide, is the device a defibrillator or is it not? And the reason this is important is because with defibrillators, the magnet cannot affect the pacing mode, whereas the magnet can affect the pacing mode for most pacemakers. If the defibrillator is there, the next step is to disable ICD therapies through the magnet if no adjustment to the pacing is required. But if the pacing to adjustments are required, then that should be done through programming. Next, if the patient is pacing dependent, the device should be put into an asynchronous pacing mode so that electromagnetic interference will not cause inhibition of pacing. The surgery is the next step. And finally, reprogramming the device after the procedure is always performed before the patient leaves, and tachytherapies are re-enabled. We have a magnet checklist. Not all positions, such as prone, are compatible with using a magnet on the chest. The magnet has to be not in the sterile field. We want to make sure that the magnet mode activates preoperatively, especially in the case of leadless pacemakers, where it can be difficult to localize the device with the magnet. And some leadless pacemakers may not have a magnet mode. And if there is an ICD, then just a reminder that the magnet does not affect the pacing mode. And importantly, to talk about how to determine what type of device is in the body, the next figure that we share goes through the different device types. First, panel A showing how to determine between a transvenous ICD versus a pacemaker, focusing on the coil. That's typically on the right ventricle lead. And then panels B, C, D, and E show some of the new devices that have come out since the last guidelines were written by the HRS and anesthesia and AHA groups. Leadless pacemakers, the panel B, and dual chamber leadless pacemaker on panel C, the subcutaneous ICD in panel D, and the extravascular ICD in panel E. And then finally, loop recorders are more and more seen here, and we've provided examples of each of the different manufacturers since they have slightly different form factors.